Today I want to talk about a common subject, which is what do you do if your doctor orders a CT scan on you? Or are CT scans dangerous? Do CT scans cause cancer? What is the data on this so that you can be better informed? Now, CT scans have an upside, definitely, because they give you information. You can see things that you can't see on an x-ray. So if the doctor is looking for a tumor, for a lump, for a cyst, for a something, a CT scan can be very valuable. If somebody's looking for a tooth infection or an abscess, a CT scan can be very valuable. It's a two-sided edge because a CT scan is a type of x-ray and there is ionizing radiation. There is x-ray radiation that is going to come into your body when you get it. So a lot of times the real question is the diagnosis needed by getting a CT scan or not? If it's needed, you're kind of stuck with doing it. If it's not needed, maybe there's another way that it can be looked at with an ultrasound or some other technology where you don't have an MRI, where you don't have to actually do the ionizing radiation. Of course, the doctor's going to make that decision, but I think if you're informed on it, it can be very helpful. Ionizing radiation causes free radicals. The energy in the ionizing radiation is so strong that it starts to break apart normal tissue and normal membranes, and that's where the damage comes in. Okay? Now, we are in radiation all the time. The sun is emitting radiation all the time. Our cell phones are emitting radiation. We live in a sea of radiation. The normal background for most of us living in a regular city environment is about what's called 3 MSV per person per year. That's about what the background is. Okay? Now, added to that are things like, what if you get a dental x-ray? Well, it's another 0.01. It's a little bit. It's not nothing, but it isn't very much. What about a DEXA scan? Your doctor is checking for your bone density. He does a DEXA scan. It's an x-ray. It's very, very low. It's 0.001. So it's really low. Okay? What about a chest x-ray? Well, it's much higher. It's 0.1. Okay? So if you get a lot of chest x-rays, pretty soon it starts to add up. A mammogram is 4 times a chest x-ray per breast. Okay? So now we're up to 0.8. So now that's getting more. And if you do it every year, now you're starting to add up. And I'll show you some statistics in a little bit of what happens with more and more mammograms and what happens with the incidence of breast cancer. Okay? Because it's not nothing. Okay? A CT scan of the chest is 7. Okay? So that's a lot more. Okay? A CT of the abdomen is 10. A lot more. Okay? A CT angiogram, if they're looking at heart arteries or brain arteries, they do a CT, like for the chest, it's 51 to the breast. Remember, the baseline is 3. A chest x-ray is 0.1. A CT angiogram of the chest, because it's going to go through the breast, is 51 to the breast and 64 to the lung. Now, these are big hits for the body. These are radiation. These are cancer-causing waves. Okay? Now, when you look at mammograms in breast cancer, what you find out as the younger you get it, the younger you start your mammograms, the worse it is. Okay? Because that time adds to the chances of you getting more cancer. Okay? And they found that women had a 2.5 times more risk of cancer when they had more mammograms. So these things can be really significant. Okay? So if you're younger, it's worse. If you get them more often, it's worse. But more importantly, especially when we're talking about breasts, is there another way to look? Can we do an ultrasound? Can we do an MRI? Can we find out the same information in a better way? Now I want to transition a little bit now, because a mammogram is an x-ray. Okay? It's radiation. It's 0.4 per breast. Can we look at the breast in a better way, in a safer way, and get information that's a lot better than what we're going to get from the mammogram? Now, this is called thermography. Thermo means heat. Ography means we're making a picture out of it. So thermography actually is an infrared camera that measures the heat coming off the breast itself. And red is very hot, and green is cooler, and blue is the coolest. Okay? Now, let's say someone is brewing breast cancer. One cell turns bad, and it starts to become a cancer cell. And in 90 days, there's 2 of them. In a year, there's 16 of them. Now 16 cells you can't see. I mean, it's like really teeny. Okay? 2 years, there's 256. 3 years, there's 4,896. 5 years, there's 1,000,000. 8 years, there's 4 trillion. This is where it gets detectable by mammogram. So when someone has a positive mammogram, they've had disease brewing for an average of 8 years. And by the time they found it, there's 4 trillion cells there. Now that is a very late finding. That doesn't help you. You got it now. What's beautiful about the thermography is that it's detected at the 256 cell level by thermography. Why? Because the cancer cell very early starts to get new blood vessels because it needs more nutrition. And those new blood vessels add circulation to the breast, and they add heat to the breast, and the heat signature shows up early. And we can detect early breast cancer. It might not even be really significant cancer. Do an intervention at that point where if we detoxify the breast, if we do some special treatments on the breast, where we can get this thing to go away, because you won't see this on an MRI or a mammogram or any other technology. It's way too soon, it's way too early. But if you have this technology, you say, oh, something's going on there. Let's handle it. And I've done this many times with people. Sometimes it's hormonal imbalances. Sometimes it's environmental toxins in the breast. Sometimes it's an iodine deficiency. Sometimes they have a parasitic infection where we see, oh, that breast is abnormal. Okay, let's get on that. And then 6 months later, we do another thermograph, and it's like, oh, the breast is returned to normal. We got it before it was really significant. Okay? So that's really important. And you don't have to do the mammography. Okay? Now, I want to just compare the two things. So, another problem with mammograms is that there is a high rate of false positive. The false positive means the mammogram says there's something there, and the biopsy is done and there's nothing there. Now, there is nothing worse than a false positive, because the woman goes to get her annual mammogram, and she gets the mammogram, and the mammogram shows, oh, there might be something there, and the recommendation then is you need a biopsy. And the emotional things that occur to people when, like, oh my God, I've got breast cancer, and now I need a biopsy, and someone's going to stick a needle in my breasts 5 or 6 times to try to get that thing pinpointed and make a diagnosis on me. The sort of emotional travail is horrible. And about 15 or 20% of the time, when it shows that there's something there, there is nothing there. And you went through the whole thing for nothing. Okay? So that's not good. Okay? There's also about a 15 or 20% chance of where there actually is breast cancer there, but it doesn't show. So the mammogram as a test is really not very good. Okay? It's pain. The breast, if you've ever had a mammogram, I haven't had one, but I'm told, they squeeze you. They've got to flatten this thing out. Now, if that tumor is encapsulated and it gets squeezed, do the cells come out? Is there damage done? Okay? These are all things that aren't good. Now, the cancer is stimulated by radiation, because the mammogram is X-ray, and X-rays cause cancer. So if you have something brewing, it's going to stimulate it. All right? Now, what's nice about the thermography is it provides information on the root cause. It detects the growth very early. There's no radiation, there's no compression. You basically sit in the room and you put your arms over your head, you put your arms like this, the infrared camera takes the picture, and that's it. Nobody touches you, nobody does anything to you, they get the picture, it goes to a board certified radiologist who reads it, and he says, this looks really good, or hey, there's something suspicious here, maybe we need to do an ultrasound, or maybe we need to do an MRI. We have to investigate this further to find out what is actually going on. Okay? No radiation, no compression. And it tells about the activity of blood vessels that are going on in the breast. So here's a normal. This is a beautiful normal. Breast should be blue. Okay? Blue means cold. The breasts are off the body. Their temperature is generally cooler. So this is right. Okay? You look at this and you say, holy smokes, what is going on up here? This is hot because there's blood vessels. That tumor has got blood vessels in. And this is someone who's got cancer of the left breast. Okay? So the pictures are very helpful. And it can be, a screening can be done like this once a year, starting at young age. So you have a baseline. And for, I don't know, $250, $300, something like that in most places, you get the screening done, it's all good. Okay? So we already talked about that. This is really important. A mammogram is not early detection. We want early detection when we're dealing with cancer because the earlier we get it, the better. Okay? A cancerous tumor has been growing from 8 to 10 years before it's big enough and dense enough to be detected by mammography. That's why the treatment at that stage is so drastic. People end up with mastectomies and they're carved up, and chemotherapy and radiation. If we can get to it way before, it's way better. And I've found in my experience, it's a reversible process. You get this early, you can reverse it. Because the person, why do they have this? They're toxic. And if we can get the toxins off and the hormones balanced, we can get them back. Okay? Now, this is interesting because breast thermography is FDA approved as a treatment, as a diagnostic treatment since 1982. Though you don't hear about it much, and the standard has been regular mammography. But there are several countries like Canada that doesn't allow mammography anymore because the results just aren't good enough. You know, it's a downside treatment. It's not an upside treatment. So, breast screening is really important. Something like 1 in 8 women in their lifetime nowadays is going to get breast cancer. If you get breast cancer very early or pre-breast cancer really early, it's a reversible process. And you don't end up with disfigurement and toxic medications. So this is something that should start probably by the time anyone is 20, 25 years old. They should start getting annual thermographies, and they can be followed. And if there's a problem, the doctor can do an intervention. A doctor like me could do an intervention, and you can reverse the process. Okay? Annual mammogram screening, I don't like because it's too late. It doesn't help you. 15 or 20% of the time, it's wrong, and that's not a good thing. And it causes cancer. So go with the things that make the most sense, and this makes the most sense. We want to give people the idea that they have power over their bodies, and they can, through the diagnostics that are available, give them indications of what they should do so they can live healthy and live long and not get cancer. Okay? I hope this helps.